Hi there, my name is Rachel Miller, and this is my presentation for marijuana policy in the United States, the history, ethics, and social justice, and this is for Social Work 670, mental health and addiction policy. I want to apologize ahead of time. My volume, for some reason, doesn't work the best, so I'm trying not to scream, but I'm also trying to speak plainly and clearly so you all can hear me. But the history timeline that I have set up from the 1600s to 1890s, hemp cultivation and medical use. Hemp was encouraged in colonial America for rope, sails, and clothing. And by the late 19th century, marijuana derived from hemp became a popular ingredient in medicinal products sold within pharmacies. And then 1906, Pure Food and Drug Act, the requirement of labeling of cannabis and over-the-counter remedies. 1910 to the 1920s was recreational use. So recreational marijuana use was introduced into the United States. And then 1937, Marijuana Tax Act. The Congress passed the act officially banning marijuana use at the federal level. 1970 was the Comprehensive Drug Abuse Prevention and Control Act. Congress repealed most mandatory minimums for drug possession, so marijuana categorized separately from other narcotics, and the National Organization for Reform of Marijuana Laws was founded. This is history timeline continued. 1986, the Anti-Drug Abuse Act was signed by President Ronald Reagan. This was mandatory minimum sentences for drug offenses, reinstated, and penalties for marijuana raised and equated in some cases to other drugs. 1996, the Compassionate Use Act and medical legalization begins. In California, the passage of Proposition 215 legalized medical marijuana use for people with AIDS, cancer, and other serious illnesses. And I'll talk a little bit more about that further on in the presentation, as well as the other two that I'm about to mention. 2020, the MORE Act removes cannabis from the Controlled Substance Act and decriminalization of marijuana. And then 2024, the Doobie Act passed in 2024. This bill makes it illegal for federal agencies to use someone's past marijuana use as a sole reason to deny federal job employment. So the Compassionate Use Act of 1996 was presented as a humanitarian and medical reform created to relieve patients with serious illnesses such as AIDS, cancer, and chronic pain. Many advocates argued that patients were being criminalized for seeking relief from these symptoms related to different illnesses, and the policy was to allow physicians to recommend marijuana as an alternative option when other medications were not effective for these patients. During the 1990s, several factors influenced the passing of this policy, such as the HIV and AIDS epidemic, where medical access to marijuana would provide symptom management as well as patient autonomy. This was a big thing during that time too. Many individuals that did have HIV and AIDS were ashamed, embarrassed to go to doctors, so they felt that medical marijuana was more private, and they utilized that in a different way. Some intended and unintended consequences of this policy itself. So legal protection for patients and physicians directly involved in medical marijuana use, and a public shifting to a state policy rather than criminalization. Unintended consequences would be in the state and federal conflicts of the Controlled Substance Acts, increase in marijuana dispensaries that were frowned upon for serving recreational users rather than medical consumers. And then during the introduction of the Compassionate Use Act, many opponents used fear-based rhetoric campaigns such as an increase in teen drug use, instead of really focusing on what many patients were needing medical marijuana for. Many of these individuals that were against this act tried to put fear into people that may find it beneficial by saying that teen drug use may increase because of it. And then the Compassionate Use Act has not been overturned or loosened, but it has created additional support in many other policies, such as like the Medical and Adult Use Cannabis Regulation and Safety Act. The next one I chose is the HR 3884 MORE Act. So this stands for Marijuana Opportunity Reinvestment and Expungement. It was implemented to address social justice and equality needs, especially in low-income Black communities. The public attitudes and values that impact the passing of this policy are a shift in harm reduction as a public health issue rather than criminal enforcement. Also supporting organizations including the NAACP, NAACP, I'm struggling, the Leadership Conference on Civil and Human Rights, as well as the NASW. And then the intended consequences and the purpose were to decriminalize marijuana and remove the list of scheduled substance under the Controlled Substance Act. Unintended consequences are how states and federal agencies align, and a possibility of unintended barriers that could overshadow social justice goals. There's many different views on the MORE Act on both sides, and it was promoted for fairness, social justice, and equality, but also for views of public health risk and teen drug use. So the MORE Act has not been enacted into law yet, but it has been reintroduced into the House. So it passed the House in 2020, but it remains proposed in federal reform due to not passing the Senate. The next policy is known as the DOBI Act. So that stands for Dismantling Outdated Obstacles and Barriers to Individual Employment. This act was introduced to the Senate in 2024 to limit the consideration of marijuana use when making an employment suitability or security clearance determination. Public attitudes and values impacted by this policy include fairness and inclusion in federal hiring practices. Intended and unintended consequences are seen as federal agencies will no longer use past marijuana use in the hiring process for security clearance jobs. So unintended consequences could be workplace safety concerns, a more strenuous security clearance process, and negative public perception. Senator Gary Peters states that the bill would modernize the federal hiring process, where others fear that the bill could create security risks. And the DOBI Act is still pending legislation and is not fully implemented into law as of yet. The ethics and social justice lens of these three different policies that I've chosen. The first one is the Compassionate Use Act. So it supports self-determination and autonomy when making decisions about patients' medical care and those decisions. The social justice and equality for the MORE Act aligns with social justice principles by advocating for change and promoting racial equality. And then the social justice and equality of the DOBI Act promotes fairness and equality as well as an individual's privacy when applying for employment at a federal agency. The NASW Code of Ethics with the marijuana policies that I've listed applies the NASW Code of Ethics principle of the dignity and worth of a person by promoting autonomy and affirming a patient's rights to self-determination by choosing the correct medical treatments to best fit their needs. The MORE Act applies the NASW Code of Ethics of social justice by challenging systemic barriers within underserved and marginalized populations while working towards expunging past convictions related to marijuana use. And then thirdly, the DOBI Act applies the Code of Ethics, social justice, and the dignity and worth of a person by respecting privacy as well as the hiring process within federal agencies and not punishing applicants for prior marijuana use. So some things that I would change on these policies and any kind of modification and further advocacy with these policies would be the reduction of barriers to medical marijuana. Education, I'm always preaching about that and awareness to work towards reducing the stigma around medical marijuana use. Collaborate with policymakers and legislators to assist in treatment funding, community workshops, and advocacy for policies, as well as additional education. And then gain support from local officials and law enforcement while conducting, say, town hall meetings or any kind of meetings within your local level, not just the state and federal, but your local community to advocate and educate about these changes. And then this is my reference page. I hope you guys enjoyed my presentation. I had a little bit of difficulty finding different things about the marijuana policies that are currently in place and the ones that are still in reform, but I think this is good progress for all of us to learn about different policies at different levels. So I hope you guys enjoyed this, and thank you very much.